It's hardest for me to have this cup in my hand.
Because, go inside it. The cup itself isn't what's hard here.
Because I know you want me to reach in there and touch that disgusting, filthy dirt.
Right, and if you did?
And if I did, it would be on me, and I can't even think of that, about what it actually touched the stuff and have it on me, and I might get it on you. I might get on these clothes, and
I'm
probably
going to ask you to get it on me, actually. We'll deal with that when we get there. We'll see. So, in other words, what's hard about this is these thoughts. These are thoughts. So we're going to get with the dirt, but I want you also to sort of watch what's going on in your body. What's showing up. In your emotions, what's showing up.
Well, physically, I can feel that I'm trying to keep this as far away from my body as possible, from my trunk. This sitting position, if I could push my arms any further away, I would.
Well, then why don't you bring the comb forward? That's it. Okay. We can just use this like a reverse compass. Whose life is this, anyway?
And what else am I doing? I'm trying as hard as I can to not move my fingers.
Okay, so I'd ask you to move your fingers. Good. Good that you noticed that.
All right, I'm going to withdraw my hand a little bit so I can look in this cup.
Okay. Okay. What else is your mind telling you? Especially, I think it's really good to watch for things that it tells you not to do.
Well,
we want to catch these little moves to go away.
It's telling me to not smush it around much because it might grind into me.
Okay, good. So thank your mind for that good advice. And why don't you put it right in there and just squish it around a little bit.
All right. Ugh.
ACT is commonly said to be an exposure-based therapy, and in fact that's right. But our model of what exposure is different than what's sometimes out there. Frankly, we think it's a model that's better supported, both by the animal and human basic literature. Exposure from an ACT point of view is not simply about reducing some conditioned emotional response. Exposure is about establishing flexibility in the presence of a feared object or situation. In order to do exposure of that kind, the other elements of the ACT model are critical, because you have to be able to look at your thoughts in a diffused way, to open up to your emotions in an accepting way, in order to step into the situations that occasion those difficult thoughts, feelings, memories, and bodily sensations.